That Show continues on City News.
101.1 FM and 1310 AM.
Well, thank you so much for spending time with us today on City News on this Valentine's Day. We're so happy that you're here. Ottawa Public Health certainly has a sense of humor. They've put out a social media post today, and it says, please use condoms on Valentine's Day. It's the safer option. Plus, we have enough Scorpios already. Sexitsmart.ca. Lots of fun from, of course, Ottawa Public Health. We wanted to get caught up today with the one and only Drew Klein. How are you, Drew?
The one and only. Hi, Sam. Nice to see you. Happy Valentine's Day.
Happy Valentine's Day to you. Of course, from FocusWave Center. Tell us what you do, Drew.
FocusWave Clinic, yes, we're Ottawa's only locally owned focused shockwave therapy clinic. We treat erectile dysfunction, Peyronie's disease, chronic pelvic pain syndrome, and bladder and urinary incontinence. And we're the only locally owned clinic in the city using this very specific shockwave therapy technology. It's painless, side effect free, and requires no downtime for almost anyone. It's a really amazing stuff, and looking forward to a busy Valentine's Day today.
And Drew, some of those topics are hard to talk about.
Yeah, it's high time we destigmatize men's sexual dysfunction. It's going to require. It honestly starts with your partner. Ladies, men, you have to step up and help your man, encourage them to seek treatment if they're having issues, whether it's with ED, Peyronie's disease, which is curvature of the penis, painful erections, or chronic pelvic pain syndrome, which is unexplained pelvic pains. And so we do really require you guys to help us out and throw the kitchen sink at whatever the problem is.
And it's such a good point because it can affect a relationship so much, Drew. Those first conversations can be difficult. Any suggestions for us?
Well, like today, big sexpectation day, right? So, there's a lot of expectations that people put in their relationships for Valentine's Day. There was a pharmacy in the UK that recorded in 2020 the highest recorded sales of PDE5 inhibitors like Viagra and Cialis. So there's a lot of expectations. So setting these expectations is really important. So I was actually going to turn the table on you, Sam. What are your expectations from your partner on this holiest of February days? How do you deal with the expectations set in your relationships?
Well, let's put it this way. I haven't had a relationship since pretty much Ronald Reagan was president, so it's been a long time. But in terms of relationships that I've been in, there is an expectation, right? Absolutely, there is. But those conversations can be difficult, and it's difficult for women, Drew, to bring it up, to be honest with you, because we don't want them to feel bad about themselves.
Yeah, you have to tread lightly, obviously, know your partner. I think for new couples or burgeoning romances like this time of year, it's where you have to think, is this the person I want to spend the summer with? Is he gonna make a fool of himself at the Canada Day barbecue? And the guy's thinking, does she need more social media validation from Instagram or from me? So relationships are tough, but committed partnerships, you should be able to talk about these things and set the expectations. 75% of people expect to get something from their partner on Valentine's Day, whether it's $100 of love merch or some tenderness in the bedroom. But you know what they say about expectations? They're the mother of all disappointments. I think that's Sylvia Plath. So get your communication on point. Don't beat around the bush.
So talk to me a little bit, Drew, about when you have somebody come in for the first time.
You like that pun, eh?
And then when you see them through the treatment.
So what we do is we offer a free consultation for all of our patients, whether it's to assess the condition, whether it's erectile dysfunction or if it's Peyronie's or chronic pelvic pain syndrome or bladder incontinence. And we determine whether or not you're a candidate for our treatment. There's no cost for this consultation. We want to make sure you're a good candidate. And then depending on the severity of your condition, we'll offer a number of choices. Usually we start with a limited treatment course to see how the treatment affects you over a 4 to 6 month period. and see how you respond to it. Everybody responds differently. It doesn't work for 100% of people, but the technology we use is the very best in the world, and it's from the pioneers of the modality, and it's amazing, exciting stuff. But like I said before, for almost everyone, painless and side effect free.
Are people nervous seeing you for the first time, Drew?
Well, not me. I'm kind of an easygoing person to talk to. I'm not the one doing the treatments,
Right.
but no, for our patients, we have a discreet, lovely facility. It tends to put our patients at ease, and we have long conversations about how our patients can make the changes they need to make, improve their vascular health. Men's health really needs to, be put at the forefront here. We are suffering as a gender, if I could say that, and we need to really make the improvement. So we try to make it as easy as possible. And
do you think you bring up such a good point about men's health? We've talked about a lot here on the Sam LaPrade show over the years about everything from prostate cancer to just regular checkups and everything in between. That message is one of the big reasons that I wanted to have you on today, is because I think those conversations we can have them, and we take the stigma and the taboo away. Then hopefully it actually results in a better quality of life for everyone.
Men need to really start focusing on treating the cause of the problems they have, not just treating the symptoms, whether it's diabetes or hypertension or any of these diseases which can be treated. But there are ways to treat the condition rather than just the symptom, and we need to, I think, break away somewhat from the allopathic style of medicine and look into different ways, like shockwave therapy as an amazing, non-invasive, relatively natural procedure to improve vasculogenic health and reverse chronic pains and a number of different conditions.
What was the pandemic like for you, Drew? Were you able to still see people, or did you have to close the clinic?
Oh, we were open. We opened during the pandemic, actually. That's the way we roll. We went headlong into it, October 2020. And, unfortunately, it appears that COVID, the respiratory virus caused by SARS-CoV-2, does tend to cause fertility and erectile dysfunction problems. It's been noted in some scientific literature that that's a consequence of getting infected. So I don't know that it's been busier because we don't really have a starting point, but we've been seeing patients the whole way through and doing our best to help improve the sexual conditions and dysfunctions of men in Ottawa.
Mm-hmm. And Drew, I have to ask you, when you meet a group of people, maybe go to a cocktail party and introduce yourself, what's the reaction from people when you tell them what you do?
I have a lot of different responses for that. It depends on the company I'm keeping. Most people are quite polite about it and interested. But the majority of our patients do understand that this, is a problem that is affects quite a few people. 50% of men over the age of 50 tend to suffer from some form of ED, and 10% suffer from PD at some point in their life, Peyronie's, and so it's quite a common issue, and we talk about it quite bluntly. I'm as you know, I don't pull any punches. I'm ready to talk about anything. There's no stigma in here.
Mm-hmm. Which is really, really good, Drew. I appreciate you joining us on this Valentine's Day. How are you celebrating?
Oh, just gonna do something beautiful and lovely for my beautiful and lovely wife, like I do every day. I don't need any special holy holy day in February to do that. So we try to take care of each other as best as we can every day. Valentine's Day is just I'm a retail heretic. I don't go. Hallmark hates my ass. So.
Thank you so much, Drew, for joining us today. I love that beautiful sentiment. Thank you.
Thank you, Sam.
Drew
Bye.
Klein joining us today, FocusWave Clinic, talking about some of those taboo subjects. We covered a lot today. Appreciate his time for sure. We wanted to speak